Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast, brought to you by perimenobliss.com and ablehealth.us. And today I want to talk about the link with perimenopause and your blood sugar, hence along with type 2 diabetes. So just so we make sure we're all on the exact same page, type 2 diabetes is a disease? No, a condition in which your body can no longer handle the sugar that you've taken in. Now, this is not to be confused with type 1 diabetes. That is related with an autoimmune condition, usually in kids, which leads to diabetes. Type 2 diabetes is linked with lifestyle, which is why we're going to get into I changed that. It's not a disease, it's a condition, because that means you have control over it. So, because the big thing is that in mainstream medicine, what I have seen, at least where I practice, is that once you get your blood sugar starting to get elevated, they say, well, tell you what, we can give you metformin, or we can refer you to a dietitian, and then they can work with the dietitian to see if you can bring your blood sugar down on your own. Then they send them to a dietitian through the hospital, but then the dietitian puts them on a high carb, higher sugar diet, which means that there's no way they're getting their blood sugar down. So then, therefore, they have to end up going on metformin, and then often other medications after too. And they're like, "Well, I tried the diet part and it didn't work," and it's because you were almost led astray from the start. So I've worked with a lot of diets. I've worked with a lot of clients with type 2 diabetes, and I want to share some of that experience and how that all links to perimenopause. Because point number one, this is the part that's interesting. This is why men, compared to menopausal females, but men compared to a premenopausal female, men are much more likely to get diabetes. But once it's after menopause, that all changes. And the reason is that estrogen and progesterone increase your body's sensitivity to insulin. What does that mean? And let me explain what insulin does. When you have a bunch of sugar that you take in, your body releases more insulin. And this insulin helps bring down the sugar out of your blood and into the cells. So out of your blood into the cells. If the cells are sensitive to insulin, they'll get the reaction and they'll take the sugar in. But after a while, if there's way too much of it, the cells, it's almost like the boy who cried wolf. They're like, no, we don't need that much. And the insulin's like, no, more. And eventually, your body just becomes insensitive to the insulin and no longer responds to its call. Okay, so estrogen and progesterone make your body more sensitive to insulin, so it's easier to maintain lower blood sugar levels. But, as we know, in perimenopause, your progesterone levels and your estrogen levels start to dive. And as they dive, your body becomes less sensitive to insulin. And as you become less sensitive to insulin, it becomes harder to maintain your blood sugar. Which takes us to point number 3. This is why diets that used to work for you before don't work for you now. A lot of times people, and not that I'm going to pick on this diet in particular, but in this area there's a very popular diet called Weight Watchers, and it works great. But the thing is, with Weight Watchers, they, at least at this time, they don't really care so much what you're eating. It's more about calorie counting. So if you're like, well, I used to just reduce my calories and I would lose weight and I was fine. Now you don't. And it's because now it's not just about how much you're eating, it's about what you're eating. Because as insulin levels increase, it becomes harder to lose weight. So if you're taking in more sugar, but your body is not responding to the insulin, so therefore your body starts producing more insulin, and your body's still not responding, these elevated levels of insulin have some negative effects. One of them makes it much harder to lose weight. The other thing is the next point, which is what we call, sometimes it's alluded to as type 3 diabetes. Now, this is not confirmed, but they often refer to Alzheimer's as type 3 diabetes. And what they have found is that people with elevated blood sugar and type 2 diabetes are dramatically more likely to develop Alzheimer's. So, increased levels of insulin and increased levels of inflammation are linked strongly with Alzheimer's, which means that as your hormones decrease and your blood sugar and your insulin stay high, and therefore you get more inflammation as well, it increases the likelihood of Alzheimer's. Not only that, there's also another direct links between your hormones and your cognitive ability. So what we want to do is just make sure that we're really clear that we want to balance your hormones. We want to not just change how much you're eating, but we need to change what you're eating at the same time. Which is why point number 5 is you need to avoid the food pyramid if you want to avoid the triple stack. What is the triple stack? So I'm sure you're familiar with the old food pyramid, in which it's, at the base of the pyramid it was all the grains, carbohydrates, all the high sugar stuff, which was like basically showing that it's the majority of what you're supposed to eat in the day. In doing so, just the levels of obesity and diabetes in North America has just skyrocketed. What is the triple stack? The moment you have higher levels of blood sugar, they don't just give you medications now for blood sugar. In their mind, they're preventing, they want to, you have high blood sugar, so you're more risk for heart disease. So they're going to give you something like metformin for your blood sugar, but then they're going to say, even if you don't have high cholesterol, we're going to give you a statin anyways, just because they consider that to be prevention. And even though you don't have high blood pressure, we're going to give you that anyways too, because the moment you have higher blood sugar, you're now at risk for heart disease, so we're just going to treat that in advance. So they're doing these treatments in advance rather than correcting the underlying problem, which is your diet. Which means instead this is where the mindset shift comes in. Because you can have diabetes, but you don't have to be a diabetic. Diabetic just means that your blood sugar is consistently over a certain point, depending on the type of measurement system that you're using. That's all it means to be a diabetic. You don't have to be a diabetic, and you're not going to be a diabetic forever, but you will, in this case, always be carbohydrate sensitive. So it's changing your mind from a disease standpoint to a condition standpoint, because you have control over the condition standpoint. You can change your diet to a lower carb diet, you can balance your hormones, and therefore you're not diabetic. You're carbohydrate sensitive, but there's so many food options now in today's world to eat that's going to work better for you anyways, and they're easy to access, that you can live without those medications, without the triple stack, without the side effects that come along with it, and not only prevent diabetes, but prevent a lot of other inflammatory conditions to go along with it. So I hope this was helpful. If you or someone you know that is along this path where you're like, now you've been labeled pre-diabetic, or now you've been labeled the onset of diabetes, make these changes. Again, go on to perimentalbliss.com or ablehealth.us, or find a health provider that works in this aspect, and get yourself back on track. This is Doc Yates, signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit perimentalbliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.